Hi, I'm Evi Dimitriadou, a certified yoga therapist by the International Association of Yoga Therapists, a physiotherapy graduate from Manchester University, and I'm currently doing a master's degree in Psychology and Neuroscience of Mental Health at King's College, London. In addition to running a yoga therapy clinic, I'm the program director of Yoga Therapy Greece, where we educate about yoga therapy. I would like to share with you in this short video what we do for people who have cardiovascular diseases, such as coronary arterial disease, peripheral arterial disease due to hypertension, atherosclerosis, etc. Cardiovascular disease is one of the most common non-communicable diseases. According to the World Health Organization, non-communicable diseases such as cardiovascular diseases, diabetes, asthma, COPD, and cancer are a result of many factors: behavioral, physiological, environmental, and genetic factors, and are responsible for almost 70% of all deaths worldwide. Lack of physical activity alone is responsible for 6 to 10% of all non-communicable diseases-related deaths. This is the reason world experts keep mentioning the imperative need for physical activity to people with non-communicable diseases, and especially to people with cardiovascular diseases. A high-quality, tailor-made yoga therapy program is of huge importance, addressing not only the individual needs for physical activity, keeping the blood pressure balanced, managing stress levels, but also motivating for any necessary lifestyle changes, such as cutting smoking and having a healthier diet. I have worked with many people who have had cardiovascular diseases, and we always start by bringing awareness to the dysfunctional habits, such as unhealthy diet, emotional eating, inactivity, smoking, high levels of stress, high levels of worries, and lack of joy. In Yoga Therapy Greece, we motivate individuals towards a necessary behavioral change by building a compassionate therapeutic relationship and believing in the power of people to become the best version of themselves. After bringing people's compassionate awareness to their habits, we learn how to regulate the nervous system, which is highly related to the cardiovascular system. In fact, the cardiovascular system is affected a lot in the long term by the nervous system, the way experiences are perceived, and the overall life perspective. We learn how to balance the nervous system by gaining breathing awareness and by learning how to breathe slowly and deeply, elongating mostly the exhalation. The more we breathe slowly, the more we self-regulate the nervous system. The more regulated the nervous system, the less stress hormones such as cortisol are secreted, the less the risk for cardiovascular disease and for dysfunctional habits. In addition to learning how to breathe slowly and deeply, we shift the mind to a more positive state, enabling us to feel at ease, more peaceful, and even more joyful. We do this by chanting or repeating personal positive affirmations, something proven and used extensively in corporate environments and for behavioral change. We also do this through short recorded personal guided relaxations based on each individual needs. Robust research studies have shown that these guided relaxations have a huge effect on releasing tension from the mind and the body, balance the nervous system, enhance peace, contentment, safety, and make behavioral changes possible and easier. Through a careful body and movement assessment, either live, in person, or working online, we gradually introduce appropriate to the individual movements that release tension from the body, particularly from the chest, the neck, and the shoulders, where quite often it's accumulated. We also focus on the extremities, increasing awareness, blood circulation, and proprioception, especially in cases where we have peripheral arterial disease, diabetes, or metabolic syndrome. Through short, personal yoga therapy practices, specifically designed for each person and further developed in every session, the individual is able to practice safely at home and at the workplace. People learn how to breathe, how to manage their stress levels, and release tension from the body and mind, but also how to regain control and quit any unproductive habits. Through a well-structured yoga therapy sequence with all the yoga tools modified to the body and posture, the breath, the energy levels, the thoughts, the beliefs, expectations, and of course, a lifestyle and the symptoms. We have supported many people of different ages with cardiovascular disease, and we are grateful. They believed in us and they allowed us to make a difference in their lives. I hope you found this of interest and helpful. Please share it with people who have cardiovascular disease or even only hypertension, so they know something can be done and that they can be understood, valued, and supported. For more information, please visit our website www.yogatherapygreece.com or our Facebook page, Yoga Therapy in Greece, or our YouTube channel, Yoga Therapy Greece. Thank you very much for your time.